One local medical expert wants to see more screening done for postpartum depression. Consultant psychiatrist Dr. Earl Wright says, like some other medical conditions, PPD often goes underdiagnosed, which is not good for the mother and baby. TVJ Shamela Pullen tells us more in this evening's edition of The Health Report.
Postpartum depression, PPD, affects at least 20% of Jamaican women. It is a mood disorder that can lead to severe depression 4 to 6 weeks after giving birth.
Most women, when they are going through postpartum depression, they feel tired. The fatigue level is increased. They don't take care of themselves as much as they should, and they socialize. They don't want to talk to other people. They withdraw from society. They are not able to take care of the baby as well as they should.
Consultant psychiatrist Dr. Earl Wright says in an extreme form, postpartum depression can lead to postpartum psychosis. With this condition, a woman may try to harm herself or baby, become paranoid, or may become disoriented. It is why Dr. Wright recommends that mothers who have just given birth be screened for PPD before they are allowed to leave their health facilities.
It should be improved. It's recommended, and it should be. It's not done as on an ongoing basis as it should be. It's many times you go into a health center or in the hospital and the screening for depression is not routinely done. And it's recommended that screening for depression, it should be done. It's just two questions.
Dr. Wright says with treatment, PPD may go away within a 6-month period. If you don't get treatment or if you stop treatment too soon, the condition may turn into chronic depression.
With medication, reducing the stressors, that is increasing the support system, increasing the social interaction, and the medication for postpartum depression is usually a mood stabilizer instead of antidepressant. Exercise is also very important.
With your health report, I'm Shamela Pullen wishing you good health.